Hello, doctor.
Yes, where am I
Over
talking?
here.
Oh, there, okay.
Hello. I'm just wondering what you would say the evidence is around supplements after weight loss surgery if you're eating a whole foods plant-based diet. Do you find your patients still need to take as many supplements?
It depends which surgery. The gastric bypass, because we're bypassing part of the intestine, they tend to need to still take. But my patients that eat more of the way I want them to eat seem to require it less. I haven't really I haven't taken my data and looked at it analytically, so just offhand, I would say they tend to need less vitamins than. Funny enough, B12 deficiency seems to be way more prominent in my meat eaters than my plant eaters. Now, that may be because my plant eaters tend to be more compliant with my recommendations, and I do recommend taking a B12 supplement, so they're taking their supplements. The meat eaters aren't being compliant with my diet recommendations, so they're not compliant with my. So it's not really a scientific statement, but I get a lot of B12 deficient meat eaters, I'll tell you that much.
You said that you hate macronutrients, and it's a really big thing now with like fitness influencers and on social media. They're always talking about macronutrients.
They love macronutrients.
Yeah, they love their macronutrients.
Yeah.
So I was just wondering if you, like, what are your opinions on proportions? Do you think there should be any, or more focus about eating whole foods?
Oh yeah, it should be all whole foods. I just can't, because people don't. I mean, what is steak? It's protein, but it's also a bunch of other stuff. You know, what is bacon? Well, there's protein in bacon. Does that make bacon good? Like, you know, I'll tell a patient, I want you to eat an apple for a snack, and then they come back and see me. I had this one lady, you know, they're eating like a protein shake, and I'm like, you know, I told you to eat an apple. Yeah, but an apple doesn't have protein. I'm like, oh my God. I mean, I had one patient who was a really smart. She was a NASA scientist, a rocket scientist, and she was from Ghana, and she came in. I do not understand why I have weight, because I eat very healthy. And I'm like, okay, well, let me look at your food. I was like, well, what do you think it is? She goes, well, I think it's my carb intake. And I'm looking at her diet, and it's like that other one I showed you. It's just like eggs, chicken, steak. I'm like, you didn't even write down a single carb on this list. And she's like, oh yeah, well, I'm from Ghana, and about, you know, twice a week I'll go over to my friends from Ghana's house, and we have a traditional Ghana meal, and it's very high in carbs. I'm like, so you're telling me that the Ghana meal is the reason you're overweight, that you eat once or twice a week? Yes. I'm like, have you ever been to Ghana? Now, I knew something about Ghana that she might not have known, because I study obesity. They have the least obesity in the entire world. So I said, have you been back to Ghana? And she was like, yes. I was like, were there any obese people there? She's like, oh no, they were looking at me like I was like something out of a movie. I was the most overweight person there. I was like, ah. And they eat Ghana food? She's like, yeah. And I was like, and what happened while you were there? She's like, well, I was there a couple months. And I was like, what happened to your weight? She was like, actually, I lost weight. I was like, aha. And then it clicked to her, wait a second, it's not the Ghana meal. So, that's the problem with macronutrients, is we start to like label foods good and bad based on macronutrients, but nothing's a protein and nothing's a carb. They're all mixes of this. The other thing that kills me is when I say carbs are good, people think I'm saying that donuts are good. No, there's more fat in a donut than there's a carb. A donut's not a carb, just like a pizza's not a carb. So I can't stand the macronutrient thing. I think it's a real disservice. We need to be talking about whole foods and as unprocessed foods as possible. It should be fairly common sense in 2020 what we should be eating. But Joe Rogan's eating nothing but meat right now. And he has less aches, he says, so therefore we should all do it. Yeah.
Hi.
Where are you?
Over here.
It's like a blinding lights. Oh, yeah, there you are. Okay.
How are you? Thank you. I'm a little technical oriented, so I hope you don't mind this question.
No, I don't mind it at all.
Tell me about the IGF-1. You're saying it's a growth factor. Do you mean in the chickens and the meat, or in the kids because they eat that? And that's part of a few things.
So IGF-1 is in your body. It's created in your body. It's stimulated by certain amino acids, specifically leucine, which is why people say, well, what's the difference between animal protein? I've got several reasons I think animal protein is different than plant protein. First of all, what comes with it, because nothing should be taken in isolation like I was just talking about. But also because animal protein has a different amino acid thumbprint than plant protein does. In other words, animal protein has very high leucine in it, which the bodybuilders love because they want IGF-1 stimulation, because IGF-1 stimulation will help them grow some muscle. Which is not to say that plant-based people can't grow muscle, but typically you're taking extra protein supplements to get that IGF-1 stimulation. Secondly, animal protein also has more methionine, which is a sulfur-containing amino acid, which leads to acidosis. This is getting more technical.
That's good.
Yeah, but basically, if you're eating a high animal protein diet, you are stimulating IGF-1. How much that participates in obesity is hard to say, but I think it has a role in it.
And the other thing I was going to say is I was interested what you said about the stretch on the vagus nerve.
Yes.
And that butyrate, because I've heard of that in another way. I didn't know it was a short-chain fatty acid versus medium-chain, but if you could say
so
something.
short-chain fatty acids are very interesting. They are made by a certain microbacterium in your bowel. And we know that short-chain fatty acids are extremely anti-inflammatory. And so if you look at people that eat a higher fiber diet, they have higher short-chain fatty acids. They then tend to have less cancer or dysplastic cells in their colon and colon cancer, things like that. But we're also now seeing that this may have a role in other things, anti-inflammation and possibly even in affecting certain satiety hormones.
Thank you. The last thing was, what was GLP-1 with what kind of bypass?
Yeah, well, the gastric bypass, it activates a hormone called GLP-1. So GLP-1, it comes from these cells in the small intestine called incretin cells. And GLP-1 is the same hormone that a lot of the diabetes medications are trying. In fact, the diabetes medications were somewhat created because of the results that gastric bypass was getting. So they said gastric bypass is working for diabetes. What is it doing? It's activating GLP-1. GLP-1 has effect on insulin sensitivity and insulin secretion. And so a lot of these medications that you hear, Januvia, Jardiance, all these different new medications, Byetta, they're all working on GLP-1 to increase GLP-1 for diabetes. Sure.
Hi.
Yes.
I just wanted to know where does acid reflux play a role in this surgery or in general?
Yeah, so acid reflux is a serious problem. So besides doing weight loss surgery, I also do a lot of acid reflux surgery. Diet has an effect on reflux. We know that there's a muscle at the lower part of the esophagus called the lower esophageal sphincter. Caffeine will dilate that. Red wine will dilate that. Caffeine and red wine together will definitely dilate that. So if you have some wine and coffee with your dinner, you will have some reflux later. A lot of it is anatomical. The more overweight you are, the more it pushes up on the diaphragm and create what's called a hiatal hernia, where part of your stomach starts slipping into the chest. If that lower esophageal sphincter gets pushed into the chest, it doesn't work as well, and then you get really bad reflux. The gastric bypass basically cures this, because with the gastric bypass, we're separating the stomach with all the acid away from the esophagus so that it can't get up to the esophagus. So it's a great treatment for reflux. And people that aren't overweight, we don't do a gastric bypass. We pull the stomach back into the belly, and we wrap it around itself and tie it to itself so that we recreate the valve. Getting kind of technical. But yeah, reflux is a serious problem. The best way to prevent ever getting reflux is to have normal body weight, because body weight is a big predictor of getting reflux. But certainly I have a lot of skinny patients that get reflux disease just because they have an incompetent lower valve. Yes.
Hello, doctor. Right here.
There we go. Yes.
Hello. I had a biliopancreatic diversion and duodenal switch 20 years ago.
Oh, wow.
Best thing I ever did, because
Yes.
I truly believed it saved my life at
Yes.
the time. Gained back, lost 200, gained back about 20, 25. But in the last 5 months, I've lost 35.
Great.
As I'm trying to go closer and closer to more plant-based foods. I'm not there yet, but I'm getting closer and closer. But one of the things that I find interesting is how many people have approached me and said, oh, most people who have bariatric surgery gain the weight back. And I'm like, really? And they're looking at me like I'm weird, because I haven't, not really. And so is there a high level of recidivism with people who have had gastric surgery?
So there's a high level of gaining some weight back. So there's a nadir, but getting back to the original weight, no. No. That's a very low percentage of people doing that, especially with the surgery you had, which makes it very hard. Now, the surgery you had is a malabsorption procedure. Your body does adapt to that, so it becomes more absorptive. So it is easy to gain back a little bit more weight because it becomes more absorptive. So it's normal to gain back a little bit of weight. Your body does not want to lose weight. The leptin levels drop. When you lose weight, your metabolism slows. Metabolism drop with gastric bypass looks like the metabolism drop from The Biggest Loser. So your metabolism drops tremendously. So your body's going to work to try to get that weight back. And so you do. I always tell my patients, this is a journey. It's not a destination. It's not like you arrive at a weight and you're like, I'm here, bring on the cheeseburger. It's got to be a constant work to keep yourself at a normal weight. It is. I think I see a hand right there. Oh,
Over here.
Gosh. Okay, we got
How's
over
it
there, and then
going?
someone up here wants to ask a question too.
I'm a PA. I work in the primary care setting, and I find the few patients that do come to me post-bariatric surgery are all on a very
Yes.
frequent small
Yeah.
small meals with high protein. And
Yes.
as a primary care doctor, I don't feel like they trust my opinion or what I have to say about that.
Yeah.
And I'm just curious what I can do as a primary care provider to kind of help change some of those minds and those attitudes.
Yeah, this problem goes back to the fact that I said at the very beginning of this talk, where I go to my society meetings, and the bariatric surgery kind of works a little bit too well, so well that like my colleagues have become so cocky about it that they don't even study diet, right? And they don't study food. And so they tell their patients, eat a bunch of protein, but they don't really even care about food that much, you know? And the funny thing is when people start gaining back weight and they're like, okay, well, let's do another weight loss surgery. Like, let's talk for a second about what they're eating. I mean, telling someone you're making their stomach smaller so they could eat less food, then you're going to tell them to eat frequently. That's going to make them eat the equivalent amount that they would have eaten if they had the whole stomach there. When I first got to Asheville, that's exactly what they were doing. So the surgeons there that hired me up there to come out and take over the program, they were having some, I was looking at the results. I was like, your results are not that great. And I had to sit down with the dietitians and say, you got to understand, we're trying to It turns out, funny enough, if we start getting into anti-aging, the best way to anti-age is to not eat. All right? The less you eat, the better, to a point, but the less you eat, the better. They've done all these anti-aging studies. And specifically, the less you eat of protein, the better. Because protein may be the kind of driver of aging. And so I want people to eat less. I don't want them to eat more. And so I don't want a patient eating if they're not hungry. I want them to eat on scheduled times, never grazing, and basically that's setting up grazing. And so when I changed the program at Asheville, now our weight loss is right back on track. People are doing fantastic. So what can you do is hard because they're going to trust their bariatric surgeon, but I think you could give your opinion is that they, need to eat at more structured meal times and not eat when they're not hungry.
Yes, thanks for taking my
Sure.
question. So my sister has MS, and I'm wondering if your surgery has ever had any kind of positive effects on MS?
I have done the surgery several times on people with MS. I can't tell you that I've ever seen any research that it helps. There's some research with plant-based diets in MS. There is some research with fasting in MS, interestingly. Walter Longo is one of the aging experts in the world, and he's got a diet called I really like this diet. It's called the fast mimicking diet. There's a company called Prolon that he started, but he's no longer part of, that creates these little meals. But they had one study on MS that was somewhat promising. So fasting and a plant-based diet may help with MS, but there's not any really good evidence. Does weight loss surgery help? I don't know. I've done it, and the patients did well, but did their MS do any better? I can't tell you. I don't know.
There's a new movement for this transfusion
Yeah.
to go help
To go
MS.
with the
I
MS?
don't know
Yeah.
anything.
Transfusion for MS. It'd be interesting. Got to test it. I would caution people again. You hear some of these things are so exciting. Transfusion, or this supplement or that supplement, and everybody gets really excited about that. That's not science. There's going to be anecdotal. I was speaking to a lady earlier, which is really interesting because she was asking me about meat, and she cured her cancer by increasing some of her meat consumption, which goes against everything that science says, but it worked for her. Some things will work for some people, some won't for others. Right now, the science doesn't show anything that I know of in these categories.
And one last thing.
Mm-hmm.
you kind of touched on it, but I don't know if you really touched on it. Grazing. Like every 2.5, 3 hours, I have like a piece of fruit or some nuts or some. But you're against that?
Yeah, I tend to be moving more and more. Look, first of all, and this goes to like what I just said about a lady who cured her cancer with eating some meat. It worked for her. If it works for you, when a patient comes into me and they're like, they've lost a ton of weight, they feel great, and I look at something in their diet log I don't like, I'll say to them, look, this goes against what I typically teach, but it's working for you, so do it. In general, I find that grazing is counterproductive to losing weight. It tends to allow you to consume more calories over the daytime because you're not getting that stretch receptor full. Now, some people argue that originally when we first started doing frequent meals, there used to be a stage where I sat up here and told people, eat frequent meals to lose weight. Because the idea was it would prevent you from getting so hungry that you eat too much at the next meal. The evidence is now moving against that. It's moving more to this time-restricted areas of eating at certain specific times. I think Brenda said that this morning too. Eat at a certain specific time every time and don't graze. In my experience, which is pretty vast on this topic, grazing tends to get people gaining weight. Which to the person asking about how do you gain weight, you graze, eat all during the day, yeah. Yes?
Thank you so much. I really enjoyed and learned a lot from your talk.
Thank you.
I'm a yoga teacher, and speaking of MS, there's a lot of improvement that people with MS can make by doing yoga.
Yeah, with the
I
spasticity,
have had
for sure.
students, and I took a special training in yoga for MS.
Oh, great. Excellent. I need to do some yoga. Tomorrow morning. How early is tomorrow morning? Yeah. Okay. Well, maybe you'll see me doing it.
Hi, you put up a slide. Could you please expand on that? You said something about drink 15 minutes before we eat and do not drink while we're eating, and then I can see the rest of
that's more for weight loss surgery patients specifically. Yeah, I should have taken that in specific. So we want the food bolus to stay in the stomach as long as possible so it continues to put a stretch on the vagus nerve. In some studies we did where we had people eat and then we did x-rays and watched them drink, it pushed the food bolus through quicker. So we found that holding it in there longer. The other thing that's interesting, and this goes to sugar, but it also goes to fruit too. If you eat like just fruit for breakfast, for instance, you may find that you're hungrier a little bit earlier. What we have found is that with more dense sugars, if you push them through pretty quickly with some water, it tends to spike the sugar a little bit faster, and then has a faster drop in sugar. It tends to make you hungrier sooner. So with our weight loss surgery patients, we have them drink before they eat cold water with a little bit of Metamucil. That kind of fills them up before, and the Metamucil slows the sugar absorption of whatever they eat afterwards. Then they eat and they don't drink for 30 minutes afterwards. Helps. Good questions, everybody. I think that's it. Thank you so much. Appreciate it.